Hey, it's Will with Social Work Test Prep, here with another practice question to help you prepare to pass the ASWB exam. So pretend you're sitting down for the real thing, and here's what you encounter. The question: a social worker sees a client who reports a lifetime of, quote, seeing things all the time, shadows. He also reports hearing voices, quote, probably the NSA, which tell him he's, quote, useless and stupid. The voices leave him feeling, quote, pretty sad and really annoyed. Given the symptoms the client describes, what is the most likely of the following DSM diagnoses? Maybe you can name it out of the gate, put it in comments. If so, you'll impress everybody. You can guess at what the choices might be. Let's see what you're actually presented with. A, major depression with psychotic features. B, schizophrenia. C, schizophreniform disorder. And D, schizoaffective disorder. Now, everything this client is, if you've worked in frontline social work, you've encountered clients with seeing shadows, with these kind of psychotic symptoms, and delusional symptoms. But what do you diagnose? We know where to turn. It's to the DSM. The question itself is explicit about that. It asks for a DSM diagnosis. Sometimes when you see a question, you're trying to figure out where you're reaching. Is this an ethics question? What is this? This one's easy on that front. All right, so inside the DSM, we get the criteria for schizophrenia. Maybe this is already inside your mind, and that's terrific. These common frontline social work diagnoses are the ones that you're going to encounter on the exam most likely. So, psychotic symptoms, some psychotic disorders, depression, anxiety, all that stuff. Okay, the criteria for schizophrenia. A, 2 or more present for a bulk of 1 month period. Delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and or negative symptoms. All right, so we have delusions and hallucinations, the shadows, and the NSA. B, symptoms disturb a level of functioning. That's true for the entire DSM. If there's no disruption of functioning, there's no diagnosis, which may come up on a different question. C, signs of disturbance last for at least 6 months. Okay, good to know. D, schizoaffective and bipolar disorder ruled out. All right, so in a minute, we're going to look at the schizoaffective disorder criteria. E, symptoms are not due to the effects of substance or medical condition. And that's also DSM-wide, right? You can't diagnose something if it's just happens due to substance or medical. So here, as promised, the schizoaffective disorder criteria. A major mood episode concurrent with criterion A of schizophrenia. Going back, criterion A was the delusions, hallucinations, and so forth. B, delusions, that's of hallucinations, that's a typo, last for more than 2 weeks without a major mood episode during the lifetime duration of the disorder. So that means you have psychotic symptoms, the client has psychotic symptoms independent of the mood episode. Otherwise, you're looking at bipolar disorder or one of the choices here, MDD with psychotic features. C, a major mood episode is present for the majority of the illness. Okay, so there's most of the time there's got to be depression or mania. And D, symptoms are not due to the effects of substance or medical condition as discussed. All right, so the key thing here, major mood episode. So what do we have in the question? We have the guy feeling pretty sad and really annoyed. That does not sound like major depression. So let's scratch major depression. And since there's not a major mood episode present, we can also scratch schizoaffective disorder. So we're narrowed down, as so often the case, to 2 choices, schizophrenia here and schizophreniform disorder. And here's one of these either you know it or you don't situations. The criteria for schizophreniform disorder, I have them here. Also 1 month period of psychosis, but not lasting yet 6 months. So schizophreniform disorder is what happens before you can be diagnosed with schizophrenia. What we have in this is a client who reports a lifetime of symptoms, and so we can scratch C, and boom, we have our answer, schizophrenia. Did you get it? Did you know it? If so, congratulations. You're on your way to holding up a pass sheet with a big smile. All these social work test prep customers have done that. Hopefully be following them very soon. To get extra help on that, please come to social work test prep. There are several, we've got 5 full-length 170 question tests. And there's also a DSM booster, all DSM questions, and an ethics booster, all questions based in the Code of Ethics. Lots of really helpful stuff. So see you there. If you have any questions for me or requests for future videos, please don't hesitate to comment. Thanks for watching, and good luck on the test. Bye-bye.